Now that Obamacare has been enacted, America has taken an unfortunate additional step in the direction of being a European welfare state. And since I'm from the Netherlands and I've worked for years on health issues on my side of the Atlantic, I can assure you that this is not good news. I'm Alina van den Broek of the European Independent Institute. I'm here in America doing this Economics 101 video for the Center for Freedom and Prosperity because many Americans are talking about repealing Obamacare, which is certainly the right thing to do, but that should be just the first step if you actually want to have a free market healthcare system. Free markets are characterized by competitive prices resulting from consumers and producers interacting in the absence of significant government-created distortions. This is the case for most things we buy, such as cell phones, televisions, computers, food, flowers, furniture, and shampoo. Unfortunately, this is not a good description of the American healthcare system, either before or after Obamacare. Thanks to government policies, an overwhelming share of healthcare expenses in America are paid for by someone other than the consumer. And when consumers are spending someone else's money, market forces are not very effective. The lion's share of healthcare spending in America, approaching 50% of the total, is financed directly by government. But even supposedly private healthcare spending is distorted by tax preferences that lead people to overutilize insurance companies. As a result of these and other government distortions, only 12% out of every healthcare dollar is directly paid for by the consumer. This problem, known as third-party payer, is what has to be fixed to restore free markets in healthcare. Yes, Obamacare moved the ball further in the wrong direction and should be repealed, but you also need to get rid of the healthcare exclusion in the tax code and use that money to lower tax rates. And you need to repeat the success of welfare reform by shifting Medicaid entirely to the states, and you need to transform Medicare with vouchers. Let's conclude by briefly explaining why Obama's system of mandates and subsidies will make a bad situation even worse. My country, the Netherlands, is a good example. In 2006, the Dutch implemented a universal insurance mandate which emphasizes on controlling overall healthcare costs, just like Obama claims he wants to do. My country's version of Obamacare, though, has not worked. First, an insurance market designed to be competitive has quickly turned into a government-sanctioned oligopoly with very little consumer choice. Second, health providers are paid by the government and insurance bureaucracies rather than patients directly. This means third-party payer problem and also enormous administrative costs. In other words, consumers and providers in the healthcare market are still not making their own decisions, but their own money, so it should come as no surprise that cost consciousness remains elusive. Don't be fooled by the politicians who tell you that government will bring about greater efficiency in healthcare. Competitive markets are the only way to promote efficiency and control costs. It's a hard job to put toothpaste back in the tube, but if you want to lower costs and better healthcare, you need to fix the third-party payer problem by reducing government intervention. Thank you for watching the Economics 101 video from the Center for Freedom and Prosperity. I'm Alina van den Broek. Please share this video with your friends and colleagues.